All right, waiting for everything to get started. Hello, everyone. Welcome to Tuesday's Table Talks. I'm your host, Mantra Lotus, the founder of the Loose Woman Sanctuary.
And I'm Tigra of Tiggy'd Productions.
Right. Today, we are with our guest, Dr. Monique Maxey. Yeah, hello. She's a clinical psychologist. And as you know, today is a very heavy discussion that we'll be discussing. Here at Tuesday's Table Talks, we do our best in working on creating discussions that are made for us to overcome certain obstacles in our lives. And we're all about becoming better. And sometimes, by us becoming better, we have to confront some difficult topics and difficult subjects, but it's all a part of the healing process. So we welcome everyone today. Again, with the topic of today, is viewer discretion. So
Trigger
please,
warning.
yeah, plenty of trigger warnings.
Yes.
So please, be advised of the topics that we will discuss and make sure that no small children are around. So it's a very delicate subject. We ask that you all participate as best as you can. Please leave comments within the chat, and let's begin. So the topic of today is about, I guess, similar, somewhat of PTSD, but we're discussing different aspects of abuse, childhood abuse, certain childhood traumas, domestic abuse, and other abuse subjects that affect us now into adulthood.
So before we even dive into it, Monique, introduce yourself. Tell us
Yes,
exactly what your background is so that we know exactly why we're getting into this.
Sure. So, my name again is Dr. Monique Maxey. As far as my background, currently I work for the state of Missouri, and I work in a forensic setting. And prior to that, so currently I work with adults.
Okay.
However, prior to that, I have worked with children.
Mhm.
So I'm kind of like full circle now.
Okay.
You know what I mean?
Yes.
But I've started off working in foster care. I've worked clinically as a therapist with children. I've worked in a residential facility. I've worked in a psychiatric facility. So currently, I'm actually completing my residency to become licensed as a clinical psychologist for the state. So that's kind of, that's my background. I have a doctorate in clinical psychology, and I have an emphasis on forensics and children and adolescents.
I want to know more about this forensics.
Yeah,
That's
me
not a
too.
common-
I'm interested.
Yeah, so can you tell us about
Sure.
that?
So, like, forensics has to do with like anything regarding the legal system.
Yeah.
So, in forensics, like, you can work just with the court system. Forensics can work with children, like, as far as like who are going, their parents are going through a divorce, and so, like, because that is involved in the courts, that can be the duty of a forensic
Okay.
psychologist. Also, things like wills, and even like what they call like psychological autopsy. So you know how you can have a physical autopsy of
Yeah.
someone, you can have a psychological one.
While they're alive?
No, after they're dead, and
I
you
thought
can
that autopsy. I was
So
like,
just-
wait a
yeah,
minute.
so
Really? Wow.
yes. So even after they're dead, like, you can maybe even see, as far as like see their mental state when they're completed their will, or see look more into how their mental state was prior to passing.
On a tangent, is that what they were trying to do with Ted Bundy's brain? Not Ted Bundy, Dahmer.
Dahmer.
His brain, it sounds like what it was. They were trying
yeah.
to do something with his brain, and I think the judge took it down, but
Possibly.
it sounds like
Possibly.
That's
I don't know what physical, because I feel like too they may have done some physical things as well,
Okay,
but
but it's-
possibly.
interesting.
I was interested. So how I got interested in the first place. Silence of the Lambs.
Okay.
High
Oh,
School.
nice.
Clarice.
Clarice. I wanted to be Clarice. So I wanted to work for the FBI, and I wanted to like catch serial killers. And however, I did not like the physical aspects of the FBI. So I, then became interested in psychology and just, like overall. So the other part, which I did mention, is of course like working with in the prison system or working for the court system. So, you are doing psychological evaluations for various reasons, from determining like criminal responsibility, was the person responsible for a crime, if they are competent to proceed with trial, if they are competent to be executed. So, or if they're competent to even stay in the placement that they're in, like if they're in general population and maybe need to be moved to administrative segregation, things like that.
Wow.
So yes, so forensics covers all of that.
Wow.
Yes.
All right, people out there, if you want to switch careers, you know something else you can get into.
Yes.
Okay. All right. I'm curious, from your experience, since the topic is abuse, with the cases that you see, how much of a past of offenders and, within forensics, how much of a past has something to do with abuse or violence with some of the behavioral
where they are
aspects?
currently.
Right.
Yeah. So as I was saying, like kind of working full circle. But you see that as well. So like I said, I initially started off with working in the school system and working for like DFS or like, the Children Protective Services, things like that. So you see children that may have been products of abuse, neglect, witness domestic violence. And so now working with adults who have a lot of that in their background, those traumas, maybe those unresolved things. And a lot of that's what happens. Maybe someone did not catch it at a certain time, or maybe they did, but it wasn't worked on. I don't want to say enough, but maybe wasn't worked on continuously, or wasn't worked on, with enough vigor or emphasis, or, so then kind of fall through the cracks, because that is what happens, because we have cracks in our system, unfortunately. And so people fall through the cracks. They don't receive the mental health services that they need, especially at that young age. And then, like you said, then you can see that now as adults. So, there is a quite large percentage of individuals who, if it's not like physical abuse, it can at the very least be neglect, not having your mental health needs met, verbal abuse. Those are all still forms of abuse. And people, do not consider that like neglect, especially medical neglect, educational neglect. Not getting your needs met. And I don't know if you all are familiar with the term ACEs, but ACEs are what's called adverse childhood experiences. And so what people now, they look at your ACEs, and based on your ACEs, you can predict like what types of issues or problems that you will have in adulthood, from medical and physical problems to addiction issues, to financial states. So these are all just going back to what you have seen in your childhood, what you have experienced in your childhood, and looking at that and predicting the likelihood of what is happening to you in your adulthood.
This is just like, I just feel like this could be like 20 different episodes, right? There's so much to cover. So I didn't even know where to start. I guess and I know it's, as a parent on both ends, having a parent and being a parent, I was like, how do you protect your child from everything you can, right? So, I mean, So, okay, so I guess we'll start with, let's say something does happen. And let's say you muster up enough courage to tell a parent. Some parents don't know how to react, or whether it's the guilt or whatever, so they either shut down. Do you have any advice for parents who may hear something from a child as how they need to react to that child, so that child feels, I guess, heard, or, so it doesn't, I guess, it doesn't exasperate.
So the first thing I would say is to just listen. Sometimes we listen to respond. You know what I mean? And we're trying to figure out, are we going to say the right things? Are we going to do the right things, or whatever? And so the first thing, you kind of have to dial yourself back and just listen. Don't be concerned with like what is the right response or whatever, because the first thing, think of yourself. what you would want from somebody else is for someone to listen to you. That's the first thing that you would want, and then we can go from there. Or but the very first thing I think is just sitting there and listening to whatever happened to to the child or your child when they come to you. And so I think from there you can figure out based on what they tell you, like where do you need to go, who do you need to call. There are just some comprehensive. Before I started working the job that I work now, I worked for a mental health crisis line here in the city, and so it's a 24-hour, 7-day a week, like constant crisis line that you can call. And people don't know. I mention that because people don't know that we have those resources.
Right. Exactly.
And so when I talk about falling through the cracks, that's one of the reasons why that agency was started, because people do fall through the cracks and they aren't linked to mental health services. So the point of that was to link people who particularly don't have access to give them access. And so that's regardless of, because calling the line is free, so it's regardless of income or regardless of anything. All you just have to do is just be a resident in 314 area code.
Is the program still around?
Mm-hmm. Yes.
We'll make sure that number is posted later.
Mm-hmm. And yes, and so that would be, something that a lot of times people will come to me. They're like, I don't know what to do. I don't know. Yeah. So I will say, to call. These are people that are trained in crisis intervention. So it's just like, to me, like it's like going to the emergency room for a mental health reason, or calling 911, for mental health reasons. So, but I think that, like I said, just starting off with listening and comforting your child.
Yeah.
Because you're feeling awkward. Imagine how the child feels.
Definitely.
You know what I mean? So just
and
like
I said,
how do we
begin those conversations where, well, first to protect as much as we can, by educating our children. At what age do you think that's a good age to kind of start, with teaching children certain, good and bad touches and certain things like that. And when if they feel uncomfortable, how to communicate,
I would say the younger the better.
Yeah.
And children can begin to learn autonomy over their bodies at a very early age, much earlier than probably we would even think. They can just learn those things and learn that this is their body. It just has to be age appropriate. So, you don't want to have the same conversation with a middle school child as a toddler. Right. But the toddler can't. We have to also unlearn things. One of the things that I had to unlearn, I saw my little cousin, okay? He was like 2. And I said, give your cousin a hug. I'll give you a quarter.
Yes.
And my friend said something to me. She was like, don't bribe him to hug you. And I was like,
yeah, because we don't think about that.
You are so right. Like, he can have the choice to come and approach me. And especially like offering him the money. Yeah. Like, I was like, okay, like, trying to get him to do something. But yes, he was 2 maybe about this. So just like, right then and there, teaching a lesson to say, you don't have to hug anyone that you don't want to. And so I interrupt a lot of times with people because they'll be like, even my sister will do this. She's like telling my niece, give your auntie a hug. Give your auntie a hug. Your uncle. Give your auntie a hug. And I'm like, I always say, she doesn't have to. She can say no.
Right, that's right.
She can say no. She does not have to hug me if she does not want to. It is no personal affront to me. Right. And that's what people have to realize. It's not about you sometimes. Yeah. So you may feel this way that, this child did not come to you or looked at you or, just gave you the screw face and wanted to run away from you. But it's not about you. And so that's what I mean. Just little small things that you can talk to your child and work with them, and so that they know, that child knows that they don't have to hug who they don't, and it's not rude.
Right.
Because that's what we teach them,
to have good manners, hug, kiss, and
and so those are just small lessons that they can learn, and it's okay.
Definitely.
Do you have any advice for parents, like how to notice or recognize signs from things that you've seen? Like if a child isn't coming forward, or like things that they should be looking out for, like that could be a sign, have you?
So I would say, just to give a, without like giving specifics, just like changes in behavior. So what you notice in your child as a norm, and then you see some differences in their behavior. So maybe, their eating habits are different, or their sleeping habits are different. Then you want to investigate. Maybe it's something, maybe it's nothing. You know what I mean?
Wetting the bed.
Yes, wetting the bed is definitely can be a sign. You know what I mean? That can be a sign. Even changes in hygiene can be a sign.
Right.
Noticing that a child used to like to do something and does not want to do that anymore, or does not have interest in the things that they used to have interest in. So now they've withdrawn. They don't want to communicate. They don't want to play. They don't want to go to a particular, pay attention.
Yeah.
When they say, I don't want to go, and I mean,
Right.
especially we like to, you going because I said you going.
Yes.
You know what I mean? And figure out why. What is the reason? Maybe it is just that I don't know, but you won't know if you don't ask. And instead of saying, well, you're going anyway, figure out the reason why.
And I think that's big in the Black community, because I said so, or even the attitudes may come, this, behavioral change. And it's like, instead of just brushing it off as though they have an attitude, that could be they're acting out for different reasons.
Well, and that's the thing, again, we have to not take things personally.
Right.
So it's not, you just showing out today and you really trying me today. It's not always that. You know what I mean? It's not, always, or like you said, even if you are giving an attitude, what is the reason why? I mean, yes, it could be hormones, because that happens. But we don't know if we won't investigate, and we won't find out why. And so, you're seeing them having an attitude, and maybe they're being emotionally dysregulated, and that sounds different than an attitude. Attitude sounds personal, like it's personalized against you.
Right.
When, just figuring out why is this child, doing these things. So
a lot of communication, it seems like.
Yes, communication, I always say, is key. Because like you said, depending on your child's age and how they communicate, maybe they won't say things verbally to you, but they'll show you in other ways. They may act out, throw a tantrum, and you're thinking that the tantrum is just them being defiant when it's indicative of something else.
And what's the best way to confront something? So, say unfortunately, if a child has been abused and a child tells you something, what is the steps? What are the steps to do well, of course we know, to get the child help. But say there is a predator, or, even a family member, or something that needs to be confronted. What is the best avenue to do that?
So the first thing when you say that, my first thought is safety.
Yes.
So it has to be you have to be safe. Are you going to be safe in this confrontation? And so you have to think about your safety as well, because, what if it's not safe at this point to confront this person? You have to think of that. So I would say first look at that. Then after that, it also depends just on your comfort. Maybe you also have an issue with confronting this. Maybe it's an elder. That's also something that is very revered in our community, having an elder or having, someone of higher status in our family. And so maybe you don't need to confront them. You know what I mean? Do it really depends on you. You can protect your child and get your child out of harm's way. And maybe the confrontation comes later. You know what I mean? Maybe that conversation comes later, because like you say, you're getting your child help and you're dealing with the issue, but you may not have the mental bandwidth.
Right.
That is a lot.
Yeah.
You have to deal with not only getting your child help, processing that something has happened to your child, processing how you're feeling about it. And now you're talking about processing, handling this
as a family now. Right?
Yes.
Yeah, it's a whole, like you said.
Right.
Yeah.
So this may not be, I would not necessarily say that's the first thing that you need to do. I would say that there are other steps that may take place, and then you kind of go back and see. This may need to happen with the third party present.
Right. Exactly.
This may need to happen in court. You know what I mean?
Right.
So it's so I would say, as far as that, like, don't necessarily feel that you're not there for your child because you did not confront.
That's a big one.
Yeah.
Yeah, that's a big
one.
And
I feel that, and I will say this. As a child, I was sexually assaulted. And my mother lived with a lot of guilt because she felt like she didn't do enough. When I felt she did more than enough. I told my mom, she believed me. She did go and have a conversation with people. She respected what I said when I said I didn't want to testify and go to court. She did, and so that's the thing. So I say that too because I'm saying that to you all also as parents. You know what I mean? You're feeling like, oh, I did not do enough for my child. I did not. And I wanted you to know that, like, that was more than enough. Her believing me was currency, gold. Yes. You know what I mean? Yes. Like, her talking to me, her stopping everything to address this. And then her also listening to me when I said I did not want to go to court. Right. And I did not want to. I did not want to relive this. I wanted to go back to being a kid. I wanted to go back to playing with my dogs. I didn't want to deal with this. And she did not push me. And so I didn't find out until I was older that she lived with a lot of guilt, feeling like she did not do enough. And she did. Like, you didn't have to go and punch this man out for me to feel like you was my mama and you was there. You know what I mean? But that's what she felt like. Yeah. That she did not protect me, or she sent me to this place and this happened. And even at 12, because I was 12, even at 12, I could understand where my mom was. I could feel her love. I could feel her there for me, and that's what I needed.
What advice do we have for either kids or even into adulthood? Maybe it's blocked out, but it comes back when you didn't have that support from a parent. Like, what advice do you have for those souls as far as healing from that?
The first thing I will say is it's a process. It's a process that you have to be gentle with yourself. You didn't necessarily receive certain parenting. And you went through life and you grow up and you feel that there's still this void that comes. And you try to fill it with lots of things. And sometimes these can be vices, sex, alcohol, drugs, whatever. You try to fill this void. I would say to talk to someone and to get some help. And know that it is going to be okay. That it will. Because like you said, that people don't have that way where they can talk to that person, or they don't have that person, and sometimes you won't have that closure. You know what I mean? Sometimes you just will not.
How do you do that if you don't have a closure?
How do you don't have
I think that's a very difficult point to kind of, because it's like you want to address a situation and you want it to be over and done with, but sometimes in certain situations it can't be over and done with. So how is it, and I think it's very imperative for individuals who feel as if they cannot move on from a situation because they haven't been able to address it, or or feel that it's been unresolved, or that healing aspect has not been confronted,
right?
So what do we do?
Well, so I was just saying this in therapy today. What you resist persists.
Teach.
And a lot of times, like, we may try to suppress things. I also say, it's I use the metaphor dirty laundry, but really, like, when you put dirty laundry aside in the hamper, it's out of sight and it's out of mind, but it's not washed. It's not dealt with. It's not done. All you did was get it out of sight.
Right.
And if you keep putting that dirty laundry in there, eventually your closet is going to overflow.
Right.
Yeah. and stink.
Right.
And stink. And now you're out of clothes. Now you know. And so that's the thing that you have to actually address that and go through it. Now, here's the thing. You may not be ready. That's okay. That's okay if you're not ready. Because that's another thing people do. Then they try to rush and be ready, and they rush and go through things, and you're not. And so you just kind of skimmed over the things that you needed to, but you didn't do the deep enough work to get at the root of the issue. Sometimes you may have to go several times to, to get. We are complicated people. We have layers. And so maybe the first layer you dealt with, and then you're like, I'm cool, right? And then an anniversary comes up, or something comes up that triggers you. And now you're like, oh, I'm back to the same place that I was when I thought I was better. Well, maybe that's another layer now you have to go through. And it's okay again to be gentle with yourself, because it's not like, oh my God, I didn't get better, this and that. You have to understand you had an event happen to you that was not normal. And then if you didn't have support, like, it is amazing that you are here and that you made it. And you deserve to have the ability to work through whatever it is to make you better and to make you whole. You aren't going to forget what happened, right? The goal is to integrate it within your story. To you now have had the power return to you. And the power has not, stayed with whatever the event that has happened to you. Right. So it's learning to deal with it, because it's not going to go away, but we do have to learn how to cope, different people, that's why you look at it, you say, like, one event can happen and different people react, right? Mm-hmm. Some people have the capacity to deal with certain things. They have the resources that are there, and some don't. Maybe internal, maybe external, but that's the thing, is that, so if you don't have the resources, then you have to have that in order to deal with that travesty.
And so what would you say? I've been blessed to be able to parent many children. So I've had foster children and my children, and surrogate children over the years, and a lot of traumatic backgrounds. And in my household, it's always been okay. When a child comes in, we'd have to get, we automatically get therapy. And so setting up certain visits, and over again, trying to get the children, to the visits and have them go, but knowing that they are not ready, and not willing to even, or not able to allow that certain part of aspect of healing to take place. And so over time, it's been, these children now are basically adults, so how do we, as parents, as loved ones, when someone who's been hurt, when someone is going through pain and suffering from a past that they had no control over, yet the steps that we in a sense know to try to help, and the resources that we can try to to offer and put forth, but they're not ready. What do we do besides still be existing? It's like, what is it? Besides to still be ready. I'm here, I'm waiting, whenever you're ready. I'm waiting to be there to help, to to be the bridge, to hold your hand, to whatever. But it's hard.
It is. It's very hard. It's hard. It's hard to see your loved one that is going through this, these times. And then you say, okay, well, I've set you up with these things, and then especially if they're doing things that maybe act out or destructive.
Gosh. Yeah.
Because unfortunately, aspects of PTSD and dealing with, trauma responsiveness, which is basically how you respond once a traumatic event has occurred, can involve some destructive behaviors. And so it can be very painful to sit there and watch someone that is destroying, hell bent on this. I say you have to meet people where they are. So, first of all, seeing what relationship it is with this person that they're meeting with. One of the biggest healing things of therapy is the relationship with the person providing therapy. Mm-hmm. So you can have all of the most expert, treatment programs. No, you can have the best, and there's no connection. And without that connection, there's not going to be much progress made. Mm-hmm. So that would be the thing, is that even just trying to get a connection between someone. Maybe, I can have a client that we did nothing but dribble a basketball, mm-hmm. You know what I mean, for like 6 months. Wow. Or just, we're playing cards. They have to build trust with me. Yeah. I can't say, you gotta get this. We on a time clock, and you gotta go ahead and get my treatment plan. My treatment plan said in 90 days, you gonna be healed. No, you can't. You have to meet them where they are if you want to make progress. You know what I mean? So whether it's that they're gonna test you, they want to see if you're just gonna simply show up every time. Right. You know what I mean? If you're gonna show up. They're going to do things to push you away. They're going to do things, to test you, to see where you are. But like I said, you as a parent or caregiver, look to see what kind of relationship is going on between that child and that provider. And maybe, you can at least work with that. Right. Mm-hmm. And then they can provide and feel comfortable, because it's not going to be until they let their guard down. Other thing I would say is to try different modes. Sometimes it may not be talk therapy alone. Mm. They may need to do some type of movement therapy, like dance therapy. Mm. You know what I mean? They may need to do play therapy, even if they are beyond play age, which I don't believe, because everybody, we can all play. Right. You know what I mean? But play also offers a nonverbal way to express yourself, just as like art. And so maybe you don't have the words, especially if something has happened to you when you were pre-verbal. Yes. When you were pre-verbal and something happened, you do not always have the words, but it's carried in your body. Yes. And you may need to do, a different type of therapy in order to get those things out. So like I said, I'm not certified in art or play therapy, but I've definitely done both.
So where would we just search play therapy in different aspects of therapy? Mm-hmm.
You can search, or you can ask. I don't know, you may search and need like a registered play therapist, or you may have someone like myself who has aspects that are built in. I'm not a registered play therapist, but I do use certain techniques, in therapy to work with someone. But also, like I said, that's your therapist has to sometimes think out the box, have to do certain things to maybe reach that person, because they're not reaching them with traditional talk. So, right. I do a lot of different things, and meeting the client where they're at. We're discussing different music, and we maybe do something therapeutic through what they're listening to, what they, So, yeah, you just have to find someone that is that will work with you, and not just kind of stay, okay, we're doing this today, you're doing this worksheet, you're going to be done in this time frame, and then that's that. There's no cookie cutter approach, and if you find someone that's doing a cookie cutter approach, that's probably not the person that you want to gel with.
And I know we mentioned this before on a different show, but if you have that cookie cutter therapist, it's okay. It's kind of, I forgot how she worded it, but it's basically like you're interviewing for the job. So if you go to one cookie cutter and that's their interview, okay, they didn't get the job. So it's okay to move on. Don't feel like you failed because it didn't connect, like with any other relationship. It didn't connect with that first therapist.
Exactly.
Try again.
Exactly. It's just like with your doctor. You know what I'm saying? That every doctor is not for everyone. Every medical doctor, you know, is not going to be for everyone. Someone may like this in a doctor, where someone may like other qualities. And so you're exactly right. You're interviewing. You're finding out. And I definitely, like in this day and age, most people have a website, have things you can look at. Most people offer consultation, you know, so that you can sit there and get a feel for that, and that's usually free. So, you know, and even if you're in a situation where you have like a sliding scale or low income, there's still choices. You know what I mean? There may be choices or not as freely as if you had like insurance or you were paying out of pocket, but there are choices, you know. And I would also, you know, definitely encourage people to understand that and to practice that. You know, if you have a psychiatrist who is talking to you crazy and won't listen to you, or you change, get out of there. If somebody tells you, oh well, no, you can't change, leave, because you can. You know, and I think, you know, sometimes that people don't realize that, or they don't feel empowered to do so. You know, so, and that's a big thing that they need to do, is feel that empowerment to go ahead and say, I want to choose the person that's going to help me in my healing.
Right.
So I know we've talked about like sexual abuse, PTSD a little bit. Can we talk about this child abuse? Because I feel like most black people, I mean, let's speak on it. And I know it came from slavery. It came from slavery because, you know, that's what the master was doing. So that's what they did with their kids, to get them in line. And they kind of, So, you know, we all got switches and belts and extension cords. And, you know, how does that affect? I mean, is that why I'm so violent sometimes? like, tell us how that can affect you into adulthood.
It definitely can. You know, certain things were functional at a time that are not functional now.
That's right.
You know what I mean?
I think that's a great
It might have been functional to snatch your child off the sidewalk because a white person was walking down the sidewalk and they needed to get out the way. It was functional to say, don't ask me no questions, because that child's life could have been in danger, you know, if they did ask questions. So they had to look at you. They had to stop. They couldn't put, you know, it was functional at a point. So you have to also look to see, you know, what's the function now? You know, is it a function? Is it a function now outside of control? You know,
it's generational.
It's generational, and it's what we know. And until we examine that, and you know, but you ask, like, coming from that, like, how do we go for, you know, and how do we, you know, and again, if you do find that is something that still bothers you, again, seek someone, talk to someone. If you find that I don't want to interact with my kids, but I feel like I do because that's what I know, then you may need a parenting class, you know. And I don't necessarily mean, because here we go again, people are like, well, it's differences and Eurocentric ways of parenting your child, you know, but you can still learn basic tenets of parenting. I think one of the things, like you said, with child abuse, one of the most common things with child abuse is not knowing developmental stages of childhood. So, like, you expect this 3-year-old to know X, Y, and Z, and why you did this, and why you talking to me this way, when she's just really parroting what she's heard. You know, so when I say go to a parenting class, you can learn things like that.
I agree.
You know what I mean? You can learn child development. You can learn certain things. You can learn alternative ways. You know, it does not take away your black card. I mean, seriously, you know, you can just learn how to be different with your child. You know, and so, you know, that is the thing, is that I can see those gaps. I could see those gaps, you know, like within my family, within the generation up under me saying, why is my mama hitting me? You know, because, you know, now they're going to school with kids that aren't getting hit, you know, and so they're like, you're hitting me, and this, you know, these kids are doing worse than me and they're not getting hit. So what is the issue? So, you know, again, the parent has to not take it personal, right? And also, you know, if you are dealing with the after effects and you know, of that, then that could be the time that you need to speak to someone about your own experience. Because like you said, we just kind of take it as it's normal. It's what happened. It's what, you know, we grew up with. You know,
I get real tricky. Somebody put their hands. You put your hands on me, and you ready? To, you know, it's that. You know, I know it stems from, you know, from that.
Yeah.
You know, but I'm sure there's different little things that come out in adulthood. You just don't. Think of it.
Right.
Yeah, it's like in retrospect, it's like, oh,
yeah.
I know we're gonna. It's all these different things, but I was sexually abused by one of my mom's students. I made her like 5 years old, but this it was a Caucasian kid with curly blonde hair and blue eyes, and that was what I'm not gonna say when that was, but I was like 4 or 5 years old. Mm-hmm. So decades later, something just triggered me. Somebody happened to ask. Somebody made the wrong assumption. Oh, she only dates white guys. No, I don't. But that was my type. When I thought decades later, when I thought back, the type of guys I was really, really attracted to was the abuser. Mm-hmm. Looked like the abuser. Mm-hmm. And it just blew my mind that just came, subconsciously. Mm-hmm.
And then, like, what was your response to that?
I was just like, I didn't really have a response. I was just like, whoa.
Yeah.
And I think what happened was, because I didn't even really remember, but my mom passed a few years ago, and I was going through her things, and I saw his picture.
And that's what triggered. That's what brought it all ahead.
That's what it was. Mm-hmm. And I was like, whoa. So it's not the same as, what was that one syndrome they say? It's not the same as it, but just the thought that.
Stockholm syndrome.
Yeah, so it's not the same, but just the fact that you would think that I would be like not repulsed by it, like that type of person. But no, it's exactly the type of person that I was like attracted to. Mm-hmm. I don't know. It was just crazy how it came out in adulthood, right?
Right. But it does happen. And so, like, you know, when you do, the reason why I asked, like, how did you feel about that or respond? Because, like, some people could then, like, beat themselves up and say, you know, how can I be attracted to a person like that? It's just even like with when people experience pleasure doing sexual abuse, you know, and then feel disgusted. Well, the body is made to receive pleasure, and it's a pleasurable act. And so, you know, like, if you are, you know, experiencing that, and then you feel like your body has betrayed you, you know, in that way. And so just understanding too that could have been a connection, you know, for whatever reason. You know, you may explore that more, but for whatever reason, that it could be that you gleaned onto that, you know, and not necessarily saying, oh, because he abused me, but there could be something about that, you know, that you just held on to. It could be a particular time of your life, you know, it could have been a number of things. You know, but at least, like you said, you saw that and you realized that, and so now you can identify that as a trigger, because we can also have triggers that are unknown, you know, to us, and so triggers that are unknown, and at least that one is a known, and they just come out.
Right. How do we heal? How do we heal?
Well, I it's such a touchy subject and a difficult one. I think especially because when we're talking about a history of abuse and a history of trauma because of the abuse, and that thin line of how we, in a sense, create defense mechanisms, and how we have to go. We survive. We have to survive, you know. And just thinking of certain things, I can remember I was, you know, sexually assaulted and sexually abused, and from domestic abusive situations. And within those situations, I think, especially with the dynamic of this whole, you know, family structure, relationship, what we're used to, and you know, when you're with a partner who supposedly loves you, unfortunately my mom was from a domestic abusive relationship too and situation, and I don't know how far it stemmed back, but I have hints that it stems back. So maybe my grandmom, and and God knows how far, before her. But when you're in that situation and we're considered, that your mate loves you, but then you have a mate who hurts you, and certain things are hidden and certain secrets, that take place. And the way that we defend ourselves sometimes to survive is going along, in a sense, what I would call quiet, abuse, the quiet things that, we getting hurt in the dark, and whispering certain things to try to, protect just this whole foundation of what we think is the foundation, but how it messes up the psyche, how psychologically it messes it up. And so after years of trying to, overcome that and facing some of the trauma, I remember, I guess like in my 20s or something, and then 30s, I'd be like, oh, I'm just sick, I'm just sick, just certain things from the things that I thought of that I liked or agreed to or was comfortable with within my relationships, and then having to research and dissect back as to, similar to what you were saying, as to why those things I was attracted to it, or why, it made me a certain way, almost in a sense like liking the bad guy, or liking, the person that is no good, this person is no good, not going to do you any kind of, good, is just going to be continued harm for you. But it's what we have grown comfortable with, in a sense, and and like, I know how to survive this situation. I don't necessarily know this person out the box. I don't know, this person who seems to be, a good person. That's not what I'm used to, but I know this. So.
And that's hard, because especially if you're used to some drama and chaos.
Gosh, yeah. And from birth, when you're dealing with generational stuff,
And so you say, I want this. So everybody says no drama. I want drama free. Drama free. You just drama. Right. And it's like you attract drama, and you don't want it, but like you said, it's what you know. You know what I'm saying? It's what you know. It's what you feel familiar with. It's what you can almost thrive in. Yeah. You know what I'm saying? The drama-free life is boring.
Right.
It's no stimulation, and so especially if you're used to getting stimulated in a certain way, you having constant things, and so you get into that. And it's like, okay, there's this addictive side of you that likes to, go, and so you have to be comfortable. You have to learn how to do something different. And again, you have to be patient with yourself, because again, if you've been dealing with this for generations from birth, and you start doing this work, you know what I'm saying? You're an adult. Like, imagine how long you have been learning how to do the other way. You know what I mean? And so you go to therapy 3 times. Oh, that's it. I'm done. Give yourself a chance. You know what I mean?
I'm telling you, I had therapy after therapy.
Yes. But you do. It's like you have to work through it, though. You know what I'm saying? Just like you learn how to be all of that way and all of that time. Now you're learning something different, and you're conditioning yourself differently. And so, even if you think about it like with a regular workout, how long, if you had a different one way, you're trying to re-sculpt your body into a different way, how long would that take?
That's right.
You know what I mean? So you would have to work at it and work at it diligently. And so that's what you have to do with your mind. It's this, also, you said, like, how do we heal? I think you said, how do we heal? And I talked earlier about integrating our story. You also have to, I was looking at something recently about these women who, like, the things that they did from abusive situations. And so, like, for each one of them, they had done something different, but that was personal to them. So, like, for one, she said that she had given a big party and changed her name, because that name had held so many memories. And so the biggest thing that she did for her was to change that name. So, right. So changing the name. Another lady had an incident where it was like a pet that had been abused by her partner. And so, she was able to get this pet and care, because she was scared to now, you know what I mean? she was scared at first to deal with this kitten, and so now she had taken it and learned how to nurture it. You know, so it's something with meaning and something for yourself, whatever, you know, that you can do that has meaning to you, to make, whether it's integrating that story, you know, within your own personal narrative, whether it's taking a trip, you know, or doing something that feels right for you, that feels healing for you. You know, also knowing that healing is a journey.
Yes.
So it's not a destination too, you know, and that's what we think. We're like, okay, I'm here and I'm healed. You know,
Right,
like
no.
it's no, you continue to keep going and growing and learning how to do things differently, you know, and learning about yourself. And so you continue to go and you continue to move forward. And so that's the thing. You just gotta keep moving forward. Always doing your best. It's another thing. That's one of the 4 agreements. Always do your best. So when you learn how to always do your best, you learn that your best is going to change from moment to moment.
Okay.
Your best is not, you know, your best is not the same when you're sick.
That's true.
You know,
Right.
your best is not the same when you're feeling down as it is when you're feeling 100%. The thing is to do your best. If your best is to see, do your best. You know what I mean? But it's not to be perfect. And so that's the thing. You keep trying to do your best and you keep moving forward. You know, how can you not progress? You know?
Oh, we've learned some things today. My goodness.
Yeah.
So it's like main things that I'm taking away, seek therapy. Be patient and kind with yourself.
That.
Right? Be patient and kind with yourself. And I think you said it more than once. It's just like it's a journey. Just, you know, if you fall back, you know, you get back up again and just keep forward on the journey. Right?
Yes, and I would say, you know, of course I'm going to advocate for you know, like professional therapy, like psychotherapy or counseling or whatever. But also I just say what works for you.
Yeah.
You know what I mean? Like you can have a professional, I would say. But it may be a different type of therapy for you. You know what I mean? But something that works. I think that too often we just hang around with our friends and say that's therapy.
Right.
Your friends, I keep saying it. People don't like what I say it too. Your friend's not your therapist. I don't care if your friend is a therapist. Your friend's not your therapist. And your friend's not your therapist because your friend cannot be objective. And I do get it because we are a communal people.
Yeah.
And therapy, I think that, you know, we have a different approach to therapists. We actually like to meet the therapist sometimes with people that we know because we feel comfortable.
Yeah.
You know, we feel comfortable with that person or whatever. And we like that feeling. But I say your friend can be your therapist because your friend knows you not from an objective standpoint.
Right.
You know, and they can still be a therapeutic person for you. Right. Absolutely. But I would still say get somebody else. Yeah. You can talk to your friend and do all of that, but you want to also have somebody that's objective and accountable. So whatever that is, I just say that just don't stop at your friends. You know, your friends can be great and they can be a supportive circle, but I just say just don't stop there.
I love the aspect too. I wanted to take away with it too, of having different forms of therapy. That it's not just one way. When we think about therapy, we automatically think of going to an office, sitting behind a desk with somebody, and you know, we sitting there for about an hour, you know, and that's about it. So,
and it can be very European.
Right.
You know, I mean, seriously, like, you know, and those are the things that sometimes we have to understand. Therapy does not necessarily have to be in the office. I used to talk with my friend and I would say, we're going to do front porch therapy.
I like it.
I was doing front porch therapy with all the, you know, the drug dealers in the neighborhood because they was having a drought. It was, you know, you have to like think outside. Right. Yeah, like we're not going into an office, so maybe you have to go into the neighborhood. You know what I mean? Like my very first job out of school was a therapist in a school. You know, so I was based in the school where kids were there, where they could just stop by my office. But sometimes that's what we have to do. We have to have community places. So, when I did work at my last job, I was also placed at a drop-in center. Sometimes people placed at church. You know what I mean? But it's just other ways, even, like you said, outside of that traditional setting where you got 45, 50 minutes, you see somebody, you get, sometimes got to think outside the box.
I love that. I know, I don't want to get totally out, but I know for me, because of the abuse, one of the issues that I had was actually having people to touch me. Mm-hmm. So it took me, a while to be able to be in a relationship and actually have certain touches, that were healthy, good touches. Mm-hmm. So, like, what is that? What is that called? I mean, what sort of person? So if someone has issues of being, like being that, touched, being physical, mm-hmm. Or even having, for years, I wasn't even able to have like adult conversations. Mm-hmm. I just was able to communicate with, while I was a child care provider for many years. Yeah. And so it's just my children and the children. And I had a very, very unsocial, I could not socialize with adults.
Yeah. So that could be because avoidance.
Well, it was avoidance, it was fear. I had a lot of fear. Mm-hmm.
It could also be like re-experiencing, because the touch may remind you of something that, and so because of that, like, whether it initiated a flashback or intrusive thoughts, like those are all responses that people with trauma, can go through.
So would a regular therapist be able to, like?
I would say so, at least someone who has done some trauma work and works with individuals who have experienced, abuse. So I would say, that depends on what type of trauma, because there's different types of therapy that you may seek for trauma. Because it could be anywhere from maybe just the talk therapist, but also there are therapists who do specialized work in trauma. Like there's a type of therapy called EMDR, which is eye movement desensitization. I always forget the R, but what it does is that it's not talking. It's more so exposing you to the traumatic memories and kind of reprogramming your brain. So it's a biofeedback type, so that's what I mean, like different what, you have to think about. We are mind, body, and soul.
That's right.
And so sometimes our healing has to be mind, body, and soul, right? And so that, the talk therapy may just be one aspect of it. We may need something for the body. We may need something for, even with that, maybe you needed to have autonomy over your body again for that to feel better for you.
Right. Yeah. So I had to kind of gradually do myself
and learning that and learning maybe different movement. And so then also, like we are in a vegan establishment, right? And so also what you put in your body, as a can be something as well that you may need to pay attention to, Marge, right?
I'm kidding. Things are just flashing as you talk. It's like this whole, I just love these conversations because it's just like I'm learning and things are just coming to me and it's enlightening. So you mentioned this avoidance. And so is that like a coping mechanism? Because I feel like I avoid so many things and I don't know if that stems from something. It's just like one of my, I just avoid in order to, it's a coping mechanism for me. So these traumas affect us in so many parts of our life. I feel like they just spill over. My brain is just.
So here's the thing, so you have to think about this. The coping mechanisms maybe that you use, again, were functional. They were functional. You have to look at now, are they functional now? Because they may have been functional and served you a purpose, at a certain point in your life. Now you have to look and see, is that now, are you avoiding things that can make your life better? You know what I mean? That's what I'm saying. So you know what I'm saying? You so that's a problem, because now you're avoiding things that could improve the quality of your life. And so you do have to pay attention to that, because that avoidance, now you're over relying on this coping mechanism. See, coping mechanisms are meant to just be temporary. And so they can become permanent,
right.
and you just over rely on them. It's just like a crutch. You're not supposed to be on a crutch for forever.
Right.
You know, or most time when you have a certain injury. Now I do know, of course there are certain disorders where you may be on a crutch, but generally when you have an injury, you're on a crutch until you heal, right?
Right.
And so you use that crutch, but then you start to over rely on that crutch. And it's hard to kick the crutch away unless you have something to replace.
That's right.
But then I feel like I run into another issue where I become codependent if I do that.
Well,
I mean, just like,
I think that's
or just not necessarily go from the crutch to another crutch.
I know the addiction.
Right. Yes. You go from the crutch to actually learning how to walk again, or those things. So yeah, just go out that crutch and then go get you a stick.
I'm telling myself off.
Can't do that. You can't get that crutch. You do. You have to learn how to walk without the crutch.
Okay.
And you use the crutch when you need the crutch, but not for over relying on it.
It's with all of these things, abuse, PTSD. It's like I remember years ago, I always thought PTSD was only for military. It's not. It's not. It could be from anything, from abuse. It could be from anything.
Mm-hmm.
Abuse is not just what you hear. It's not just sexual. Sometimes it's emotional abuse. It's just so many things that people need to educate themselves on out here. And this platform is just starting.
Yeah, it's just, clinically it would be anything to compromise the integrity of yourself, where you felt that you were in danger, or you felt there was perceived danger, maybe you weren't in danger, but you perceived there to be something, on. So, it can depend, but still, like, whether it's classical PTSD or like clinically PTSD, there are different types of trauma disorders. So it's not just PTSD. We have like acute stress disorder, which is a stressor has happened, but it has not happened as long enough to qualify for the diagnosis of PTSD. So it's a shorter time frame. So there are still other types where you may show issues. There can be adjustment disorder where you've had a stressor, you've had difficulty adjusting. So it's not just the clinical diagnosis of PTSD, but still in terms of like the things that you are experiencing and those things, like you said, avoidance or flashbacks re-experiencing. You can be hyper alert, hyper vigilant. We talked about reckless behaviors, destructive behaviors. You can be irritable, those are some certain things. So PTSD itself is just a cluster of certain symptoms that happen at a certain time frame, but you can still experience something, and it's still like you can have a traumatic response, to that. So like maybe, I'll give you an example, like maybe being fired from a job, is something that would not qualify for a PTSD diagnosis, but maybe whatever the situation around that is still affecting you.
Yes.
So some type of still trauma response that's going on that you still have to address, even though like you don't qualify for a clinical diagnosis of PTSD.
Okay. Wow. So many valid explanations that usually we would just brush off, but
I always say, in terms of, you look to see like how are you adjusting? How is this interfering with your life? What how is it interfering with you socially? How is it interfering with your job? How is it interfering with your family functioning? Just and so that's, to me, like when you notice that something is wrong and maybe you need to speak with someone.
I like that. That's good. Great advice. Great advice. So,
let me let y'all know what I'm burning right now. This is called a healing candle.
It sounds very good.
Yes, it's from Lit Life Creations. Y'all know that's my favorite candle maker. It is available for sale here at Love and Light Wellness Cuisine, 1325 Hampton. Now, the thing with her candles, she sets them with intention. So the reason I burned this healing candle, I knew I was going to get emotional today. Healing. This candle is fixed and dressed with the intention that you will receive healing. Meditate on the healing you seek when you light this candle, whether it's physical or spiritual. May you be healed. Okay? And she dresses it with tourmaline, and look, it's just flowers and stuff. You can't see them. I'm gonna spill the wax, but you can come check it out here. So
and
I just
smells exquisite.
It smells so good.
It smells so
I just wanted to let you know we're doing some extra healing up in here.
Right. Yeah. The healing energy. Yes. Yes. And see, I think, like I broke my elbow, and I think this is just a perfect kind of metaphor, because just like with my elbow, I have to put it in a sling, I have to care for it. I have to be careful. I have to give it time to heal.
Right.
You know what I mean? I actually was kicked out of work.
It's a good way to
work from home
right.
to heal. Sometimes maybe that's not what you can do, when you go through an injury. But just, in the same way you have a traumatic event happen to you, just, this was trauma to the body. It's going to take time to heal. And when it heals, it may not be the same elbow. Right. I may now determine the weather with my elbow now. You know what I mean? Right. It may function a little differently, but it's still going to be my elbow. You know what I mean? It's going to be, it's going to get better eventually. You know what I'm saying? With time, love, care, and attention. And so that's the same with us. That's what we do.
Thank you so much.
Thank you.
Thank you so much. Thank you all for joining us. And thank Dr. Monique Maxey for all the wisdom, the healing, the blessing. And this is a blessing. So, again, we're here as we always are.
It's a beautiful space.
Yeah.
I've never been here, but it's very beautiful. Good energy. So, yes.
Come check it out.
Yeah, come on in, y'all. Come on in. And we have other things that, we have coming up. So, Tiggy, you have...
oh, my goodness. Well, first, before I forget, we will put something, Mantra will make sure we put something on the video for reaching out for help. We'll put that number for the hotline. We'll also repeat that address. Black Therapists, is it? There's for seeking Black therapies, Black. Yeah, we'll put all the type of resources in the comments for the video so that you can look. And if you have any questions, please reach out to us and we can pass them on if we need to and try to get answers for you.
Exactly.
But just remember that there is help, and be kind, and
right.
Yes, be kind.
And we'll see you guys next Tuesday.
Yes.
Oh, okay. So Friday. Sorry. So Friday is open mic. Oh, you're not sure?
I'm not sure we're gonna do it this Friday.
Okay, well, Friday. But
Friday is open mic night, so look for that. I'm not sure if we'll do it this Friday. But
watch out for that. And then February, we have a lot coming up in February. Oh my goodness, so much fun. We're going to have a Super Bowl, Rihanna concert, Super Bowl commercial watch party. Okay, the guys be throwing balls too, if you want to watch that. We're going to have Tigra. So, look out for that. We're going to have an Indian cuisine night coming up. There's just so many fun things coming up. So just make sure you follow Love and Light Cuisine, Mantra Lotus, and Tiggy Pink. And we'll have everything posted.
That's right. Okay. Love you guys.
Thank you guys.
All right.
See you next Tuesday.
Let's see if we can get this. Ta-da.